The Evergreen Media Network Studio, powered by Scott Tree Services.
No one told me that.
No one told me that.
No one told me that. In pregnancy highs and lows,
We are tackling the I didn't knows
it's the No One Told Me podcast
with Janay.
and Tay.
Hi, everyone. Welcome back to another episode of No One Told Me with Janay
And Tay.
This episode, we are going to be highlighting Black maternal health, which is this week. Today is actually the last day. So we're excited to be talking about this. So with that being said, I want to share a few facts revolving around Black maternal health. So the first one would be, regardless of socioeconomic status, Black women in the United States are 3 times more likely to die from pregnancy than their white counterparts. This disparity widens in varieties of cities and states. 84% of maternal deaths are preventable. 30% of Black women who deliver in hospitals in the United States reported they were treated poorly because of a difference of opinions with their caregivers about rights to care for themselves or their babies. And Black women typically and historically have experienced higher rates of pregnancy complications such as hypertension, preclampsia, and hemorrhaging.
Yeah. When I first learned all this information, when we first started working for Healthy Start, I was shocked at just the data that's presented around Black maternal health. And as Healthy Start advocates, and just champions for improving maternal health in our community, we really are just truly seeking solution for this. So we're really excited to have Dr. Crystal Taylor with us today. Crystal Taylor was born and raised in Miami, Florida. She later went to the Florida State University to complete her bachelor's in science degree in family and child sciences. She loved being a Seminole so much that she decided to remain at FSU to complete her medical degree. And during this time, her love for women's health and obstetrics grew deeper. She traveled to Houston, Texas, where she completed her OBGYN residency at the University of Texas. And after 4 years, her love for family brought her closer to the home where she settled on the Treasure Coast and works at Partners in Women's Health, which is connected to Cleveland Clinic. Outside of providing medical care to her community, she enjoys spending time with her husband and 2 sons. So thank you so much, Dr. Taylor, for coming on the podcast.
No problem. Thank you for having me.
Thank you. We're excited to jump into some of these questions today and just create more awareness for Black maternal health and how we're looking to improve that within our community.
Sure.
All right, so Dr. Taylor, we see a lot of women coming into pregnancy with pre-existing conditions. As we see in the data, Black women have higher rates of hypertension, preeclampsia, et cetera, et cetera. So as a provider, can you confirm that these are issues you are seeing directly with our patients within Indian River County?
Definitely. Yeah. A lot of our patients, primarily African Americans, yes, they do come in with chronic conditions that we have to make sure we take a look at during their pregnancy. So yes, that is true.
Does it make you kind of nervous, like that you're going to do my home birth and pre-eclamptic?
Janay, enough of this home birth. We are not doing a home birth. No. Don't get me wrong. Home births are appropriate when they are. I don't participate in home births. Yes.
Well, we're just grateful for what you do participate in. So
thank you.
What are some of, a lot of moms are coming in and they're really not recognizing signs and symptoms. So, what are the signs and symptoms of these chronic issues that we just discussed that pregnant women really need to be aware of and just communicate to their doctors?
Yeah, so definitely chronic conditions is something that they've already had prior to being pregnant. So just being, forthright and truthful with whatever diagnosis they've had prior to becoming pregnant, letting us know at their, first OB exam and things of that sort. And even if it's not their first OB exam and they're looking to become pregnant and they've been diagnosed with these chronic conditions, letting us know beforehand so that we can make sure that they're controlled prior to becoming pregnant so that we optimize their pregnancy.
And do you find that pregnant women are coming and not having a diagnosis for these chronic conditions?
Yeah, that is true too, because a lot of women don't seek care until they're pregnant.
Right.
And so that's where we're able to diagnose it during their pregnancy.
That's why preconception health is so important.
I agree.
And shameless plug there.
Do you find that a lot of these women who aren't getting prenatal care before they become pregnant, that they don't even realize that they are struggling with these conditions?
Yes, that is. I see that a lot because most of the time the pregnant women are younger, and so they feel as though they're healthier and don't really have those conditions. When you're younger and you have those chronic conditions, they may not present as they would when you're older. So they're a little oblivious to it and don't know. They don't know.
Okay. So once they come into the office and you guys, run your testing and you're able to diagnose them and say, oh, you're struggling with preclampsia, or you've been diagnosed with this, based off of your results that came back, what type of resources do you guys typically provide for those patients to ensure a safe and healthy pregnancy?
So first, being open and, talking to them about their diagnosis, what it means, in layman terms, as much as they can understand. Then also we are able to, depending on what the diagnosis is, so we're talking a lot about hypertension, but it could also be diabetes and thyroid disease. We have different videos available that we can send them that can tell them more about their diagnosis. Also in pregnancy, there are different trimesters, so at different point in time, their different disease processes may present differently. So we, let them know what that could potentially look like during their pregnancy. So giving that, overall picture, beforehand. And then also telling them what could very well come of the pregnancy if these diseases don't, be controlled. But the main resources we give them is us, making sure they know that they can contact us at any time, making sure they're aware of the different, signs and symptoms that they need to reach out to us immediately about and not wait until their next prenatal visit. Right. There are different videos. And then we also have a book that we give to our moms.
Oh, wow. That is very resourceful.
Yeah, that's awesome.
I feel like when I was first diagnosed with preeclampsia and stuff, that would have really helped me. Yeah. But of course, I can't deliver here because I need the NICU. And so I've been in the blind for a long time about what this was. And it wasn't until recently I started to really understand, because I have people like Megan hounding me about everything.
Yeah.
But I'm so grateful for her because they just broke it down into layman's terms, how you said, because it's just oh, you guys keep saying I have high blood pressure, but what exactly is high blood pressure? Can you explain this top number versus this bottom number? So
it's important that we do that.
Yeah. So we also understand that social factors also play a part in maternal mental health services. So may you explain to us what happens, say a prenatal mom comes in and she's saying that she's homeless and stuff, because we know that's a big issue within Indian River County, or she's struggling with substance abuse, or maybe her partners. Transportation as well. How do you guys kind of guide those patients to make sure that they're coming to their appointments and stuff? Yeah,
so at the first visit for everyone, we try to we ask questions to see if these patients have these different, barriers to health. So like you said, the transportation and housing and all that stuff. And we do that throughout Healthy Start. We actually work one-on-one with you guys. And so we actually have someone as a representation of you guys in our office that we're able to, give our patients or provide our patients with your resources. And so we rely on you guys a lot for that. When it comes to transportation, there's actually Uber Health that we also use. So we're able to get them to and from their appointments using the Uber system. Awesome. So that's something that we use. But we really rely on Healthy Start and your knowledge of what resources are in the community for our patients.
Awesome. Well, we're happy to help.
Be there.
Yeah. We're happy that you're here.
Yeah. I didn't know that. So you said Uber Health. I've never heard of that before.
Yeah. So it's just like the regular app that we would use, for us to do whatever we needed to do. But we have one in the office where we're able to send an Uber, like a regular Uber, out to the patient's home, and we tell them what car and the person that's going to pick them up, and they bring them right to our office, and then we also have them take them back home.
That's fantastic.
You do have to be, I want to say, a resident of Indian River County. Okay. So the patients that are in Port St. Lucie or Sebastian or Brevard, County, may not be able to, use those resources. But for the most part, if you are a candidate for it, we try to, push that as much as possible.
That is so good to know.
It is. And I know that can be such a huge barrier, because we think of more of those maternity desert like areas, which are like Fellsmere, which is kind of removed. It takes, I think, one way on the GO line, it takes 2 hours to get to our hospital
because of all the stops.
Yeah.
Didn't know that, but
so that's fantastic.
Yeah, we use that a lot.
That's fantastic. So
I'm happy I know that now.
Yeah, I know.
Because I could definitely use that.
It's actually something that was brought up. Janay and I and a couple other of our coworkers were able to attend a maternal health conference celebrating Black maternal health. In Broward, actually, the Broward Healthy Start had put that on. And so they were, talking a lot about what are some of the barriers. Transportation was brought up, but we found a ton of other resources just within that conference, one specifically to preeclampsia and, the resources provided through what's the foundation is
The
Preeclampsia Foundation, right? Yeah.
That was my first time hearing about it.
Yeah.
This is my first time hearing
I had heard about it because Marty from Hope for Families used to work there, and but I had never really explored their resources on their website. But their website offers resources tailored to doctors, doulas, the patient themselves. So it was really like a great website to kind of gain resources from. They talked a lot about health barriers and stuff as well. But so we had the pleasure of attending that, and that was fantastic.
Neat.
Yeah.
There were so many women I think there was like about 300 of us in the room, and some of us were from various healthy starts within the state of Florida. We had some senators there. We had a lot of nurses from hospitals.
Good. Lots of OBGYNs, midwives.
Even men, Black men in the room.
Yeah.
Good. Yeah, it's important that we get them involved too, because they're part of this.
They're part of the journey just as much as the women,
They are
right?
part of the journey.
So we know that Black women bear a heavier burden of perinatal moods and anxiety disorders that appear during pregnancy and postpartum. So when left undiagnosed and unmanaged, maternal mental health conditions can lead to long-term adverse health consequences for pregnant women, infant, and even the family members. So when these complications are compounded by the COVID-19 pandemic, which has tremendously harmed the health of the economic well-being of the Black communities, do you guys see a lot of this when you're servicing clients? Do you know how to distinguish a patient who's coming in and she is actually going through a mental health crisis, but she's in denial because you know how a lot of us, we are like, oh, I don't need to see a therapist. I'm not crazy.
Yeah, I see that a lot too. We as women, sometimes as Black women, we have to be strong in every area. We saw our moms do it. We saw our grandmothers do it. And so, if we complain, then, why did my mom complain? Why did my grandmother complain? What is it that's wrong with me? So let's not complain. But yes, I do see it a lot. You can sometimes see it in the way that they interact with their kids if they bring them to their postpartum appointment. If you see that there is a change within, if you keep seeing the same patient and you see that there's a change in their mood. So yeah, I can see it. And then I not necessarily call them out on it, but ask them about it. How's your mood been, And if they say nothing, I then just talk about the fact that it's very common for us to experience that when we're postpartum or even, during the pregnancy, because our hormones are all over the place. And sometimes I even share my own story and my battling with postpartum depression after my kids and tell them that they're not alone, and then they're more inclined to open up and then receive the resources that we have available to them.
I try to advocate for that in the community because this is my fourth and final child. I cannot do this ever again. But with my first son, I was a college student. I remember when I found out I was pregnant, I was actually living on campus. And I moved back home. And because that's where all of our support was, my boyfriend and I, we went out at the time. We went off to college together and stuff. And I was just... After I had that baby, I was going through it so bad, but I didn't understand what I was going through. And so I'm like, oh my God, I want this baby, leave me alone. Also, I was a primarily breastfeeding mom. So I don't know where that came from because no one in my family breastfed.
Yeah.
And so I'm like, oh my God, this baby always wants me. I can't catch a break. Yeah. I had his dad in college. He was playing football, so he was busy most of the time. My mom worked. And so it was just a lot. I was just really going through it. And I believe my mom was kind of picking up on that because I remember there was times she would walk into my room and she'd be like, I'm just going to take the baby for a little, because I would pump pump as well. And so she's like, just don't worry about him. You just get you some rest.
Yeah, that's a good mama.
Oh my God.
Yeah.
But now when I started working with Healthy Start, it was after him. And once I became educated, I was like, there's no telling when I went to my postpartum visits, if they were like, or when I was filling out my paperwork, if they were like, you know, are you experiencing postpartum depression? And I probably said no, because I had no idea what it was.
Got it. Yeah.
Well,
That's
Megan
true.
just
Yeah.
shared that statistic with us this morning, which I thought was, I knew that it was a high percentage. I didn't realize, but we were talking about preconception health at our staff meeting, and just the importance of advocating that to our clients. And 23% of maternal mortality is due to mental health, which that's so crazy to think about, because that is so preventable, right? But it just comes down to making it less of this, taboo topic, and for the individual to truly come to terms with like, hey, I need help, and I need support, and that's hard to do, especially as women, as men, and just want to create an open line of communication and acceptance of the community that it's okay.
Yeah.
We're here to help.
Yeah, it's actually something that we make sure we bring up. And like you were saying, the questionnaires that we ask, not necessarily asking, do you have postpartum depression, but all the other things, like, are you feeling down and sad all the time, and not understanding why you're crying, and things of that sort. Another thing that also I think some pediatricians do is that when you're bringing your kid to the pediatric appointments, because you do a lot of them in the beginning of their life, they are also trained to pick up on it. And so if they notice it, they're supposed to direct you to your OB provider.
Okay. I didn't know that.
Well, that's a great segue into just talking about like healthcare in general too, and with our whole podcast kind of centered around Black Maternal Health Week and just discussing Black maternal health. Do you see things changing on how healthcare professionals are trained and respond to Black women experiencing prenatal complications? And as a mom of 2 boys, did you experience any barriers while pregnant?
I'll answer the latter question, or the second question first. Fortunately not. I didn't deal with any barriers to care. That's fortunate for me.
Yeah. Were you
I
a
didn't
nurse
have
at the
any
time?
complications.
Were you a doctor at the time?
So I had my first kid in my 4th year of medical school, and then I had my second kid in the 4th year of residency after, I had graduated by then in July, because he was born in July. I graduated in June. So yeah, I was kind of in the field. I wanted to be OB, but still, I didn't think I had any, true alarming complications to like, that fortunately that for me, for me,
Sure.
but that I can't say for all of my counterparts, didn't have the preclampsia or anything of that sort, which I am, at high risk for, especially with my first kiddo. But, I didn't experience that. And the first question, I'm so sorry I missed.
That's okay. No, just like how, do you see healthcare professionals,
I don't know. I must say, I was thinking about that question as I read through the script beforehand. Are we doing better? I don't know. We still have these same stories, you know?
Yeah.
So I think we're more aware of it. And so maybe we can check our biases when we're taking care of our Black moms. But I think it goes both ways, I think the Black moms are more aware of it because we talk about it more often. And so sometimes they have their own hesitancies with us as providers. And then it also, as providers, we still have these biases that we have to overcome. And I think we're working towards a solution. I think we're working towards being better providers. But we're still having these same outcomes in our moms that, look like you and I.
Yeah. So we have a lot of ways to go. What am I trying to say there?
Like
we have a long
way to go. Thank you.
I do feel like the more we bring the topic up and we, bring it to the provider's attention, it's like, this is a problem, or, just think about it. Like even with our aftershock event that we hosted last year that I put on, I don't know if you heard it. I don't think, were you there?
You just said the title of it. Where was it?
Aftershock.
It was Hulu.
It was at the Women's Center.
Yes.
So
okay.
you were there.
Yeah.
Okay.
I just didn't remember the name of it, but I was there.
Hulu. Yeah,
it was streaming on Hulu.
We actually,
the guy, the husband.
Yes, and we actually just saw Omari again.
He was there
at the
Friday.
conference.
Neat.
So he spoke again, which was awesome. And I think I have learned so much just in my time at Healthy Start, just around this topic and Black maternal health in general. And I think it just takes it also takes an individual to want to learn, because it's very easy to turn a blind eye to things that just don't affect you.
Yeah.
And so when you're ingrained in this work, it's so like, oh man, I just wish more people would pay attention. But I also have been in that situation where I'm just going through my own life and my own circumstances, and I am, just what pertains to me. So it's been a big learning experience for me to understand how everyone's affected and how everyone plays a part in making this issue better. So
I agree. Yeah.
Well, as a provider, what keeps you motivated and passionate for caring for moms and babies and families in our community?
Their outcomes. I think that's what keeps me, motivated. When we have those great outcomes, when we have moms that want to come back and want to continue to have babies and have more babies and things of that sort, that keeps me motivated. Seeing that, we're highlighting, the mortality and morbidity surrounding, Black moms. Also, the change and the shift in that, trying to make that better, keeps me motivated as well. My kiddos keep me motivated. My husband as well. He plays a good role in, my passion for medicine.
How old are your kiddos now?
One just turned 7, and then my youngest is 2. He'll be 3 in July.
Oh, okay.
Yeah,
so you know what I'm going through.
What are the ages of your kids?
My oldest is 8. He'll be 9 in August. My middle son is... Oh God, he's 3, turning 4 in October, and Caleb just turned 2 in February.
Okay.
Yeah, so I have my hands full.
Yeah, you do. But it's good. So you said 3 boys.
3 boys.
And this 4th one is?
A girl.
A little girl.
Little Ava.
Good.
We're so excited. We're like showering her with so many girl clothes.
Yeah,
I cannot wait. Oh my gosh.
She's used to all those
She's gonna take over my house.
Huh?
She's gonna take over my house.
Yeah, she will. And the boys are gonna, protect her like none other. So it's gonna be fun.
It's the little one that I'm concerned about.
Yeah, I get
2-year-old. I am so concerned about him.
I get that, but I think he's gonna adjust well.
Yeah,
they're resilient. Yeah, they are.
So I have a question. So I know a lot of moms, before they become pregnant, they're not going to the doctor, so they don't have health care. How does Partners handle those situations if a mom comes in?
Good question. We definitely get them connected to the Medicaid services. So if they don't have insurance already, yes, we try to get them we try to get them connected with the Medicaid services so that we can get them insurance. If they don't qualify for Medicaid for whatever reason and they don't have insurance, there is a financial assistance program that Cleveland Clinic offers our residents of the community, so we may offer that to them. That's also we call it the FAP program. That's also available to women that are not pregnant. But if you are pregnant, you're more inclined, I believe so, to be accepted through Medicaid. And so we just get them through Medicaid. And once, I think within 30 days, they get it, and we help them, or we take insurance. We take Medicaid insurance, excuse me. So that's the way we help moms that don't have insurance. So don't let that be a barrier for you getting prenatal care, because it is important.
And we also wanted to just bring awareness to our listeners and to our community about the brunch event that we're hosting on June 8th. That you will be a part of. Be centered around Black maternal health. So we're hoping to get a very great response from the Gifford community. And of course, anyone who wants to come and be educated on these topics or has an opinion, they're more than welcome. And so that will be a free brunch event that we're hosting on June 8th from
10:30 to 12:30.
10:30 to 12:30, right?
And that flyer will start circulating very soon. So be watching our social medias and other digital platforms. And I guess we'll announce it more on the podcast too. So so we're excited that you'll be a part of that as well.
Yes, I'm excited too.
Awesome. Well, Dr. Taylor, it was a pleasure having you on here and sharing your wisdom. We'll definitely have you back. We're going to think of some other areas of discussion that we can have. We know you have a busy schedule, so thank you for, creating some time to come on here and just talk to us. We were really grateful.
Thank you for having me.
Thank you also to our listeners who come back week after week. We actually were shared our analytics a couple weeks ago, and they are great. Lots of listeners and all over the place. That was really encouraging. So keep it up. We're grateful for your support, and any feedback that you have, always feel free to contact us. I know Janay and I are always on Instagram, and our information is provided on there. But we did want to announce just before we close out that we are rolling out an app.
Yeah. Healthy
through
Start app.
Yes, a Healthy Start app through Baby 360. This app will be all prenatal and postnatal. It will have tons of videos and resources that are educating you through every week of your pregnancy, as well as after your postpartum. And it will also be sending you emails discussing, hey, here's what's happening to your body, here's what's happening to baby.
I'm going to be the guinea pig.
Yeah. So that will be rolling out soon. So please watch out for that. We'll be sharing it on social media.
Yay, that's exciting.
All right. Well, thank you guys so much for listening. And we will see you next time on the No One Told Me podcast with
Janay
and Tay.
Nice.